Hello everyone, my name is Dr. Janvi and I have with us a very special student of ours, Dr. Sahil Vaid. Welcome Sahil
Thank you, ma'am.
and heartiest congratulations on passing your DNB theory exam.
Thank you,
And
ma'am.
I would like you to introduce yourself, what college you're in and when did you buy the Conceptual Anesthesia app, as in which year of your residency.
So, myself, Dr. Sahil Vaid. I'm doing my DNB from Adhaar Hospital, Hisar, and I bought the app in my second year.
Okay.
So basically, we had a huge workload. We used to do like 30 hours duty, and there was no concept of post-duty off. So how I use this app is like the same way I'm wearing the headphones and microphone. So I used to just wear this in OT, and I used to keep monitoring the patient while
Hmm.
just listening to those lectures. So basically, I personally had 1 month of, they gave me 1 month to study. So rest, what I did is just listen to the lectures. That's how I prepared. In the last 1 month, I used Kaushik Jyotinath. There is a book
Yes.
and
Yes.
eConceptual notes. So by
Yes.
mixing these two, I was able to just pass with 218 marks.
Okay.
So, and in my exam, I left 20 marks question in the like first paper.
Okay.
So then also I got like 56.7 in the first exam. So it was quite helpful. The app was quite helpful.
Okay. So passively listening to the lectures while you were in the OT with such a busy
Exactly.
workload really helped you. And
Yeah.
Sahil, I know you have very hectic duties, but did you get a chance to attend any of the live lectures that we have every day?
No, ma'am. No,
Okay, so you
I
watched
was
the
not able
recorded
to.
lectures.
I always watch the recorded lectures.
Okay. And amongst the books that we have released, which one did you find the most useful to you?
Ma'am, to be very honest, I was not having that much time.
Hmm.
So I had gone through the question, the DNB previous year, and
Hmm.
I just managed to, whatever answers I was able to find out. So
Okay.
I referred the notes in that way.
So the DNB theory notes that we have given were useful because you didn't have to look at 100 sources and try to make your own
Exactly.
answers. The answer was already
Exactly.
made, and considering you had a very short span to prepare for the exam, I think that was
Yes.
your go-to. Okay.
Yes.
And would you recommend anything to your juniors who are joining anesthesia residency with regards to the app, and also generally, what are the things in anesthesia that they should be keeping in mind when they start off their residency?
See, eConceptual app is, I must say, it is quite detailed. If I, if the timeline has to be like, in my case, the I got very less time. But even
Correct.
by the by passively listening to the lectures,
Yes.
you will be able to understand what the teacher
Okay.
is trying to say, and majority of the things, like there is a ERAS protocol that in
Yes.
this year I got the question. So I attempted it in a very well-defined manner, just like you taught
Hmm.
in your app. So
Hmm.
that is quite helpful. Sometimes
Okay.
passive learning from the app, um those things just strike you in the exam.
Correct.
That's what I can say.
Yes.
But those who can manage, they should see all the lectures.
Yes. Okay. And actually, that is important also because, to be honest, in every residency, we are overworked, underslept.
Yeah.
So we would rather take some time out to sleep as compared to sit with a book and read. So this is a
Yes,
very good
definitely.
way that you have followed, and you also propagate that you should be listening to the lectures while you're doing other work as well. Okay. And
Sometimes I
are
was
you
not able to
planning?
understand. I was not able to understand also what the teacher is saying, but I used to
Hmm.
keep on listening so
Hmm.
that 2 points, 3 points maybe I could get in a day.
Correct.
So it was a
Correct.
like it was a continuous journey.
That's great. And we have your DNB practical exams coming up now.
Yeah.
So I would like to tell you that on our app we have the clinical case discussions.
I know,
So
ma'am. Today,
yeah,
today I was using that, and
yes.
I was studying ABG from your lecture only.
Okay,
You taught ABG very well.
thank you. So we have the clinical case discussions as well. So go through that before your
Sure, ma'am.
exam,
Sure.
and you will be able to see like a live demonstration of how the student is asked questions. And also we have the OSCEs, which are very important in DNB. So that would be helpful. And would you like to add anything on a parting note?
The app is great. That's what I can say. It saved me from the failure. Thank you.
That is your hard work that has saved you, and we are really happy that you have passed your exams. I wish you all the best for your
Thank you,
practicals.
ma'am.
Thank you so much.